Hi, my name is Manoj, Krishna. I'm a spine surgeon. Patients who've had multiple previous operations represent a unique challenge for us. This is the story of a gentleman from Glasgow who presented having had a previous fusion at L4-5, but now the level below at L5-S1 was degenerate, as can be seen on this MRI scan and here on the CT scan. There's a cage at L4-5, but the L5-S1 disc is degenerate. We operated on him and did an interbody fusion at L5-S1 and replaced all the metalwork. Here's Nicky telling his own story. Morning, Nicky.
Good morning.
Good morning. So you've come all the way from Glasgow today.
167 miles this morning.
Okay. And unfortunately, your lovely family's not with you. It's lovely to
No, unfortunately, no. They're obviously asking all for you.
Okay.
So
start by telling me how old you are.
I'm 42.
42. And take me back and tell me a story about your back problems, because it's quite a long story.
Okay, 10, 15 years ago, I started getting lower back pain.
Okay.
And as the years went on, it started getting worse. I went to some chiropractors and had physio, acupuncture to try and alleviate the pain that I was having. And in July 2007, I ended up getting my first discectomy,
okay.
Which unfortunately I was back in within the 12 months getting the same discectomy done.
Okay.
April 2009, with still severe back pain, I was starting to get some hard-hitting painkillers.
Okay.
And I ended up getting a fusion.
Okay.
This
is in Glasgow.
Which was in Glasgow, the Nuffield in Glasgow.
Okay.
With a Dr. Wheelwright. And I kept on going back to see him because the pain was still there, and the only thing that I could explain was it felt as if the structure was possibly too tight. However, x-rays and MRIs and everything else, he kept on looking and said there was nothing else that he could do, unfortunately.
And I think you had a fusion at L4-5, well, a cage in the L4-5 disc space.
That's right.
And the 5-1 was left alone, but I think that was the level you had the previous surgery.
Yes, absolutely, absolutely. And unfortunately, within that time, my medication got more and more and more, where I was up to 44 painkillers a day.
44 painkillers a day?
44 painkillers a day. Unfortunately, life at that time was very bleak, very poor. I didn't know at some point what days of the week it was. My family were obviously very anxious and very afraid. I just wanted to go home and sleep all the time. I continued working through it.
Yes.
But family life was just terrible. Life in general was just terrible.
And I think you got quite down too.
Very, very much so. Started getting quite depressed. Sought advice on that, and it was just a case of more tablets to take.
More tablets to take.
More tablets to take.
Yep. And then how did you hear about me?
Okay, this is a good one. It came around about in May. It was getting so bad that I was thinking about registering myself disabled.
Right.
The severity of it was so bad. I sought advice again from somebody else in the profession who unfortunately couldn't help me. And in between that, my mother and father-in-law went to Mallorca for a holiday. My father-in-law, Arthur, was in a coffee shop and picked up this English woman's magazine. Absolutely. And within the magazine was a story of a woman who was very much exactly what I was like, and had been operated on by yourself.
Right.
And was very successful. Didn't finish his coffee, phoned me up and said, "You need to speak to this man.
Okay.
You need to speak to this man." And I was like that. Arthur, there's no way. Absolutely no way. 160 odd miles away. No, there's nobody can fix me. However, my wife said one more chance, just one more try. So we came in to see you, and straight away there was an instant bond for me. you did an X-ray, you did MRI, and you looked and went, I can fix you.
Yeah.
At that point, my wife was desperate to hug me.
Yeah.
You know, yeah. And I've not looked back after.
So your surgery was in June 2011. Now it's 20 months ago.
20 months ago.
So talk me through the surgery. We did an fusion at L5S1, which
That's
hadn't
right.
been fused before. And talk me through the surgery and then what happened afterwards.
Okay, surgery. I was down, I stayed for 5 days. I wanted to try and stay a bit longer, but I was sent away. Coming off the painkillers after the surgery, which went very, very well, I started coming off the painkillers very, very quickly, which was all orchestrated by yourself. Went back up the road and just continued to...
How long did it take you to come off your painkillers?
It took 2 or 3 months. To be fair, I'm on a couple of relaxants, but that's just at night. But from a couple of tablets from 44 is absolutely nothing.
Okay.
So that was me. Back running,
Wow.
skiing at the weekend there. Life is just fantastic.
And your pre-operative back pain, is that gone?
It's all gone. The pain down my right hand side leg, into my foot, the numbness in my foot, the sciatica, it's all away. It's all
And
gone.
your depression's gone too?
Depression's well out of the box. That's gone. That's touched away now. I'm fine.
And your family life improved too?
Family's great. Family time's great. Being able to spend time with my family, knowing what I'm actually doing on a day-to-day basis. All thanks to yourself.
So what about running? How much are you running?
Last week I was out 3 times, so that was 20 miles last week. Couple of bike rides last week as well, and a full day skiing, as I said.
When was the last time you did any running before you started running this time?
Maybe about 4 or 5 years.
5 years ago?
Yes.
Okay, before the surgery.
Before the surgeries.
Yeah.
So getting back to some form of fitness is brilliant.
Okay. And I think you just have a little bit of an ache at night sometimes, you said.
Yeah, sometimes it depends. I work for a major supermarket and I'm on my feet possibly 12, 14 hours a day. If I do too much, my body tells me.
Okay.
But not to the extent of anywhere near where I was. You know.
Yeah. And you're okay in the morning?
Great in the morning.
Yeah.
Absolutely great in the morning.
Okay. Nicky, thank you.
No, thank you very, very much.